Hello, my name is Rocio Avilla, and I am a dietetic intern with the PHFE WIC program.
And hello, my name is Kim, and I'm also one of the PHFE Week intern.
And today we will be talking about pneumonia and COVID-19.
So, what is pneumonia? Pneumonia is an infection that inflames air sac in both lungs. The air sac may fill with fluid or pus, causing cough, fever, chills, and difficult breathing. Pneumonia can be caused by organisms including bacteria, viruses, or fungi. Pneumonia can be ranged from mild to serious. It is most serious for infants, young children, people older than age 65, and people with health problem or weak immunity. So let's get to know our pneumonia patients. Our pneumonia patient is a 68 years old female, got admitted to our hospital on August 1st, 2021. Her weight was 68 kilograms, height 162.5 centimeter, and her BMI is 25.7 kilograms per meter square. The first time I met this patient was on August 2nd, 2021, and she was diagnosed with multifactorial pneumonia and hypoxia. The patient ethnicity origins is Caucasian. Her medical history have shown that she has a medical history of bronchitis. Her symptoms include flu-like symptoms, nausea, vomiting, diarrhea, cough, and general weakness 2 weeks before the admission. She is fully vaccinated and was tested negative for COVID on both rapid and PCR tests. The patient was an English middle school teacher, recently retired. She is also a widow, has no history of alcohol or tobacco use. The patient was unconscious during admission, so in order for us to obtain her diet history, we have to contact her daughter, which is out of town at the time. So according to the patient's daughter, the patient is follow a well-balanced diet at home. She usually prepare her own meal. However, the patient recently shown some sign of loss of appetite and weakness. The patient start to eat less and primarily relying on Ensure as the main source of nutrition before got admitted to the hospital. The patient has no medical history of diabetes and renal disease. However, the patient's lab result has shown a significant high number of BUN and glucose during the patient's stay. For example, the patient's lab has shown that her BUN level is at 21.8 and her glucose level at 201 on August 2nd, 2021. Then her BUN and glucose level went up on August 4, August 6, then went down on August 10. This shows the patient's nutrition utilization stage in critical conditions. As one of this patient's PES statement, we believe this patient need increased protein and cacao need related to pulmonary dysfunction and critical conditions, as evidenced by diagnosed with pneumonia and currently intubated. The patient was in a critical conditions at the admissions under the altered state. At the beginning of the patient's stay, the patient was immediately intubated due to swallowing impairment because she relied on Ensure as a main source of nutrition without consuming any solid 2 weeks before the admissions. The patient has received nutrition support with Vital at 55 ml per hour with a water flush of 125 ml per hour. On August 6th, the patient got a doctor's order for extubation and swallow eval with a speech therapist. As a result of the swallow eval, the patient is okay with honey-thick liquid texture. The patient was able to tolerate mechanical soft texture on August 10. This patient has shown the process by gradually getting better from the hospital treatment. The patient was extubated on August 6th, then got a swallow eval with a speech therapist. Died advancing, then transferred to a skilled nursing facility for rehabilitation on August 10. In conclusion, I have learned a lot throughout the time I did my observation with this patient. As every one of us know, pneumonia is a pretty common illness nowadays. So many people don't take it seriously. And I have never thought someone who is so healthy, following a healthy lifestyle, could be intubated because of pneumonia. Through this patient's case study, I have learned that we can't oversee any disease or illness. It is also fascinating how important medical nutrition therapy can help a patient gradually get back to their health. I know that everyone has the right to get vaccinated or not, or what type of food they should eat. However, I hope that everyone will be considering and make the best choice for their health and well-being. During the time I was interning at the hospital, I also encountered a lot of COVID-19 patients, but I would like to save it for Rocio. Next, Rocio will be presenting her part on COVID-19.
COVID-19 is a disease caused by a virus called SARS-CoV-2. It is spread by breathing in air next to an infected person who is inhaling small droplets. Having these small droplets and particles that contain virus land on the eyes, nose, or mouth, and touching eyes, nose, or mouth with hands that have the virus on them. So let's meet our COVID-19 patient. Our COVID-19 patient is an 80-year-old male that was admitted into the hospital on August 11th, 2021. His weight was 65.2 kilograms, his height was 172.2 centimeters, and his BMI was 22.03 kilograms per meter square. We encountered this patient on August 12, 2021, with a diagnosis of sepsis with tachycardia, tachypnea, secondary to COVID-19 pneumonia. So the patient reports no past medical history. The patient's symptoms include a cough, a low-grade fever of 37.9 degrees Celsius or 100.3 degrees Fahrenheit, a shortness of breath for 5 days, as well as a runny nose. The patient is not taking any medication prior to admission. He is being admitted for further management after being diagnosed with COVID-19 pneumonia. He has not been vaccinated for COVID-19. The patient is of Latino origin and currently lives with his son, daughter-in-law, and grandchildren. He is divorced. Patient has no history of smoking, drug history, or alcohol usage, and his son is a current employee at the hospital. When assessing diet history, we noticed that the patient's medical record shows a malnutrition screening tool score of 4, which does show possibility of malnutrition. He does not have an appetite, and his weight loss has been gradual for a few months due to difficulties walking. The patient would snack on small snacks several times a day and eats more during family gatherings. The patient did mention that he enjoys drinking a supplemental shake every day. When assessing the patient, since he was a COVID patient, we decided to call the patient by phone instead of walking into the room since he was in isolation. And we conducted a visual nutrition-focused physical exam outside the patient's room. The way we did this is that we asked RN to go inside the patient's room and to show us the patient's orbital, the temporal, the shoulder and lower extremity regions. So from there, we did notice that he did have mild muscle and fat loss. And when speaking to the patient over the phone, we noticed that he had lost 8.5% of his body weight in 2 months. And the patient consumed less than 50% of his estimated needs in the past 2 months, as well as during his hospital stay. So based off of this, the patient meets the criteria of severe malnutrition. We did also notice from the labs that he is experiencing kidney failure, as evidenced by an elevated BUN, creatinine, and low GFR. One of the diagnoses for the patient that we came up with was severe malnutrition related to an acute illness. So in his case, it was COVID-19, as well as a lack of appetite, as evidenced by a BMI of 22 for patients that are 80 years and older, as well as mild body fat and muscle wasting and weight loss of 8% in 2 months. In the beginning of his hospital stay, the doctor placed the patient on a cardiac diet due to his elevated troponin levels, which shows risk for a myocardial infarction. A nutritional shake, which consisted of Ensure and Live, was recommended 3 times a day along with his meals in order for the patient to meet at least 75% of his recommended intake via oral intake. 2 weeks after his admission, which was on August 25th, nutritional support via tube feeding was ordered since the patient needed to be intubated and the patient continues to have poor intakes. His kidney functions were failing, so the patient needed to be on continuous renal replacement therapy. Based off of this, his nutritional support included Nepro at a goal rate of 40 milliliters per hour via OG tube in order to replace the protein that was lost by CRRT. The prognosis for this patient was very grim. He did appear alert and aware in the beginning of his hospital stay, but throughout his time in the hospital, COVID had taken over his body. It affected his lung, his heart, as well as his kidney function. So unfortunately, on August 27th, 2021, the patient passed away. So there is still very limited data on COVID-19 and its nutritional implications. There have been preliminary studies that show relatively high levels of malnutrition among older patients with COVID-19. As dietitians, our roles in the critical care setting is super important, especially at this time, because one of the goals with these particular types of patients is to provide nutrition so that our patients could be well fed and nourished, so that they can improve their nutritional status as well as their health status. I will not suggest to anyone whether they should get the vaccine or not. However, throughout my rotation, I have seen many patients pass away from COVID. All of them have not received the vaccine. The youngest patient I have seen was 16 years old, and she was intubated before I finished my rotation. Outcome is uncertain, but I could only assume that with any patient that is intubated, it is very difficult to extubate the patient and their lungs functioning the same way. So I will leave it up to you to decide how you would like to approach receiving the vaccine if you haven't received it or not.
And that is all for our presentation today. Thank you everyone, and until next time.